Hi there, Dr. Darrow.
Hello, Nita Valens. How are you?
I'm great. And yourself?
I'm living it up.
Well, that's exciting. And we want our listeners to live it up. So if you're suffering with joint pain or muscle pain, just like the introduction said, you want to stay with us this hour and you want to give a call to Dr. Darrow at 1-866-870-5752. So what is musculoskeletal pain? It's muscle pain, joint pain, tendon pain, disc pain, back pain, ligament pain, neck pain, knee pain, hip pain, arthritis pain. You may not know what your pain is, but if it feels like stiff joints, dull aches, something orthopedic, then give the show a call today because maybe this is the day you come out of your chronic pain and begin to live pain-free. That number again is 866-870-5752. And you can also go to the website, which is www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing the treatments on videos. Very cool stuff. When you call the program today, you get a free book, Dr. Darrow's latest, called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate, and you'll hear more about what that means during the program today. We have other things going on in the office you'll also hear about, and we're here Saturdays at 10 and again at 1 p.m., and if you've been listening for a long time, and I know many of you have been listening all of 20 years that Dr. Darrow has been on the air, you might want to call the office directly, which you can go do 24/7 and make an appointment for your consultation or talk privately with someone who can help you figure out the finances of all of this. And that number is 800-300-9300, 800-300-9300, toll-free number to the office, 24/7. And again, the website is lastemcells.com. That's lastemcells.com. Our call-in number right here, right now, for you to talk to Dr. Darrow is 866-870-5752. And we have lines open for you right now. What do you think about all that, Dr. Darrow?
Well, I think it's wonderful that we can help people save themselves from a surgery. The byline of our show is Take the Surgery Out of Pain, and that's what I've been doing for over 20 years. And I had an unfortunate surgery to my left shoulder before I knew about regenerative medicine when I was in medical school. And that taught me right off the get-go that it's time to find something else, which I did. And I was able to self-inject my wrist and my shoulder with literally overnight success. It doesn't work like that for everyone. I wish it did. Everybody's in a hurry to heal. But
Right.
it often takes several injections. Back in the day, I started with sugar water. That was called proliferative therapy, meaning to stimulate new tissue. Since then, over the many, many years I've been doing this, we came into using our blood as a proliferant. That's PRP, platelet-rich plasma. And we spin the blood, we take out the red cells that are painful, and we just inject the platelets with the plasma and get very great success with that. And then about, I don't remember, 8, 9, 10 years ago, we started using stem cells from the bone marrow and have had even better success with that. We have quite a few studies on this, and Brent Shaw is our director of research. If you want to call him about the actual studies, or you want to email me, you can go to the website at www.lastemcells.com, and we can send you the studies. But I do have a book which I wrote that has, I think, about 250 studies in it about the value of using regenerative medicine of platelets and stem cells. And it's an amazing book because it changes the tide of musculoskeletal medicine and orthopedics from using surgery to using a skinny little needle where you can walk in the office and get injected and walk out without all of the fears of infections and joint replacements and tissue being cut out. The sequelae or the aftermath of surgery is often terrible. Some work out amazing. I'm not putting it down. I do love you surgeons because you do a job no one else wants to do. It's hard work. It's probably the toughest job in medicine is surgery. So I praise and I honor the surgeons. I just don't praise or honor these orthopedic surgeries. Sure, if you've got a broken bone and it's sticking out of your leg, if you dislocate an ankle, something like that, you better get right to the surgeon to have them fix it. But most surgeries that are done are things that really shouldn't be done. If you have a meniscal tear in your knee, labral tear in your hip, if you have something like a rotator cuff tear or a labral tear in your shoulder, 99 times out of 100, that should not be operated on. That's something we can help you with by just injecting. I know because I've done it on my own body. I've injected my shoulders, my knees. What else have I done? My wrist. I've had to have other people do my neck and back, and I've had great results. And I say this pretty much every show. I'm on my way out to play golf right after the show. So my body is in great shape. I will probably lift weights later and go running. And I couldn't be doing this if it hadn't have been for learning about regenerative medicine. And whenever I injure myself, which I do, I overdo it, just like most athletes do. And I just inject myself and get better. So, Nita, I'm looking at the call board, and let's try to get some callers in here.
Let's do that.
866-870-5752. Give us a call right now at 866-870-5752. And if you want to call my office and get more information, you can call 800-300-9300. I'll repeat it, 800-300-9300. And if you just want to ask me a question off the radio show by way of an email, you can go to my website at www.lastemcells.com. That's lastemcells.com. Every page on my website has a slot to email me. So I get emails all day, all night long. I answer all of them. So, Nita, do you mind if I take one right now?
Not at all. I just want to mention before you do that oftentimes, actually probably every week, we get callers toward the end of the hour and we run out of time. So I really urge you to call now. All the lines are open for you, 866-870-5752.
So let me see if this caller has come in yet. We're working on something.
Do you have a quick question while we wait for this caller to come in?
Well, I'm just going to start this. Yeah, it's not quick, but we'll get to it.
Okay.
So a person writes in back pain, and this is a little bit complex actually, but those of you that have back pain may understand. So it says L3, L4 level, mild posterior left neuroforaminal disc bulge is seen at this level, causing effacement of left neural foramina. However, no evidence of traversing nerve root impingement noted. At L4, L5 level, posterior left paracentral disc extrusion is seen at this level, extending approximately 6.1 millimeters below the intervertebral disc, causing mild impingement on the cauda equina nerves, and left lateral recess and left neural foraminal narrowing. The reason I took this question and want to tell you about it is, to me, this is medicalese. It's mumbo jumbo. And it has nothing to do necessarily with this person's back pain. So the person didn't say they had leg pain. They said they had back pain. If it's back pain, most of the time it's ligamentous in nature. It's what we call an enthesopathy. It's where the ligaments attach to the bones that the pain is coming from. It's an irritation, and it's something that we can very easily, in most cases, heal quickly using PRP or PRP plus stem cells. And I just wanted to throw this out at you to get the show started. Don't believe your MRI. It's wrong in most cases. Does that mean this person doesn't have all this stuff? No, they may have all this stuff or they may not, because MRIs are liars. They show things, they're overly sensitive, and they show things that aren't necessarily there. So my point of all of this is be careful. If you have back pain or neck pain and you see these kind of things and the doctor says, look at that, we've got to cut that out. Don't believe them. Now, if you are having arm pain or leg pain, paresthesias, funny feelings down the arm, or numbness and tingling, that may be a different story. And that's something we have to talk about because sometimes we can help that too. But be very, 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 very careful. Don't go run and get a surgery because of your MRI. If I listened to my MRI, I'd be getting surgery right this second. I've got all this kind of stuff in my neck and my back. Do I have problems? You know, I have minor neck pain and back pain from time to time. If it gets bad enough, I find a friend who does this work and I get them to inject it. If it's on places on the front of the body that I'm having issues with, shoulder pain, wrist pain, elbows, knees, ankles, hips, I inject that myself. People think that's creepy. It's not. It's easy. So be very wary not to run and jump to get a surgery because it sounds sexy and you think you're going to get a great result, because too many people that come in to see me have failed surgeries. That means that they did a surgery, it didn't work, and oftentimes they're worse than they ever were before. So I'm going to give out the phone number to the studio right now so you can call me. It's 866-870-5752. I am waiting for your calls, and I hope you do it now so I have a chance to talk to you, because by the end of the hour, we have so many callers, we can't get to all of them. So please do not be shy. We'll be very nice to you. And it doesn't have to be about you. It can be about your friends. It could be your family, your parents, whatever it is. I am open-minded to hear about any musculoskeletal pain issues. How about you, Nita?
I absolutely am waiting for your call at 866-870-5752. Do you want to talk about a couple other things going on at the office?
Absolutely. And I have a question that came in on Thursday, and I'm going to start it out with this. It says, I'm interested to know what the treatment is for androgenic alopecia for women, in specific with stem cells, and if we can get a good result and how many times will I need. I'm in Panama, and that's why I'm looking for effective solutions. I'll be waiting for your response. Thanks a lot. Regards, and I won't say your name. So yeah, we get great results using PRP or stem cells for hair growth. And there's a chapter in the back of the book, which you can get by calling into the show right now. And there are other things. If it's actually androgenic alopecia, that means that the testosterone is probably high in this woman. And people don't get it. Women have testosterone and men have estrogen. We all have all of them. So we have to do a really great job. We want to check your labs and see what's going on in your system, because if your testosterone, specifically the dihydrotestosterone, is very high, there's a very good chance that you're going to have some hair loss. So in conjunction with changing the hormones around, which we can do, injecting the scalp with a 30-gauge needle, which is like an acupuncture needle, very skinny, we can stimulate more tissue growth. So we do that in the office. And then for those of you that are overweight and you've got lower extremity pain, some of that pain is being caused because of your weight. Every extra pound on your body is 4 pounds biomechanically on your knees. So if you're 50 pounds overweight, Guess what? That's 200 pounds on each knee every time you stand up. Guess what that does? It creates arthritis. And we don't want that.
That's not good.
No, so the ideal protein diet is one that we use, and it is amazing. I did it for a week as an experiment to find a good diet, and I lost 7 pounds in the week. Most people lose about 15 to 20 pounds a month. It's really quick. It's a very fast way to get weight off your body. So let me check here.
Okay, so let's go to a caller.
Let me take Linda. You've got neck pain. Linda, how long has your neck bothered you?
About 10 years now, because I've had some accidents, and
Yes.
I've had chiropractic care to try to help it, but it just keeps reoccurring.
Okay.
And so I'm interested in the protocol that you're talking about, but I have Lyme disease, and I'm wondering if that's a complicating factor for what you do with the bone marrow and all that.
No, it's not, number one, and we'll talk a little bit about Lyme disease. I have Lyme disease, supposedly. To find out, you have to really send your blood to a Lyme diagnostic lab. Sending it to a place like Quest Diagnostics or LabCorp, they don't usually find it. But most people with Lyme disease, by the way, it's epidemic in California, not just Lyme, Connecticut, where it was named from. Anytime people go hiking in the mountains here, Santa Monica Mountains, there's a good chance that they're going to pick it up there with a tick bite. And it is passed by saliva and sexual activity. So a lot of people in this area have Lyme disease, but don't ever even know it. So you may not really have Lyme disease in terms of the effects of it. Now, did you find out from your blood test?
Well, I went for 4 years without being diagnosed, and I was very sick. I felt like I had flu-like symptoms whenever I exert myself, and it was getting worse and worse.
But my question is, did you find out from your blood test, or because a doctor diagnosed it?
I found out. I went to a doctor in San Diego, and he diagnosed it with a particular blood test. You're right.
Okay.
Most labs can't pick it up, but he sent it to a particular lab where they were able to find it.
Okay, good. So, like I said, I have Lyme disease. I have the spirochetes in my blood, but you would never know it. I'm active. I'm not tired at all. I have so much energy. I don't know what to do with it. So it has to do a lot with diet, too. And if you want to email me through the website, if you go to www.lastemcells.com, I'll give you what information I have on it. And most people that I have treated who have Lyme disease get better. So I'm not really concerned about you having that. When it comes to the neck pain, are you asking if it's related to Lyme? Probably not. I mean, most people with neck pain do not have Lyme disease. It's usually a ligamentous sprain, and you've had whiplashes, you've had car accidents. So the ligaments are probably stretched out, and you have, if you want to write this down, it's called an enthesopathy. You can look that up. And that's something that we can heal very easily using platelets from your blood. It's typically about 1 to 3 treatments. So if you want to come into the office, the phone number is 800-300-9300. I'll repeat it for you while you write it down, 800-300-9300. And I can tell you in about 2 seconds by touching your neck if I can help you. The fact that your chiropractor makes it better, but it doesn't last, means it's a perfect candidate for regenerative medicine using platelets from your blood or stem cells, which we can get from your bone marrow, or now we're getting it also from umbilical cords. Okay?
Okay, great. Thank you very much. I'll check.
God bless you, Linda, and I have good hopes ahead for you. Yeah.
Thank you, Linda, for your call. Our number is 866-870-5752, 866-870-5752, and we're going to Juan.
Hey, Juan, Dr. Marc Darrow, how are you?
Hello, sir. How are you?
I'm good. I'm going to ask you to pull off to the side of the road and get off of your Bluetooth if you can, just to be safer, and then we can hear you better too. I understand you have low back pain. How long has that been going on for?
Well, I have low back pain in a sense. I'm trying to pull over right now. What I really have is a rupture of both of my tunica albuginea.
Yeah.
I'm reading it online. I'm trying to be scientific about it. It's a bit sensitive. I'm trying not to read my phone while I'm driving. But you may know what I'm referring to.
I do.
And I wanted to ask about how to heal that.
I have to touch the area. It's a sensitive private area. And it may not be the cause of your pain. So you might have you may actually have a sports hernia. You may have an adductor tendonitis where that inner muscle attaches to the pubic bone. There's a lot of stuff going down in that neighborhood in your private area.
What
so
time?
That's not. I'm sorry?
What time?
What time do you want to come in, you mean?
Yeah.
I'll tell you what you do. You go to my website, www.lastemcells.com, and you email me, and I will call you right up, and I will set any time you want. I will fit you in, okay?
Right.
I don't care how busy I am.
Just know that I have standards. I hope you at least buy me a drink first.
Absolutely. I'll get you a drink of water or orange juice.
Oh no, I'm not talking. I'm not referring to that, sir. I'll email you later tonight, and
right.
We'll see if we can get something arranged.
The other thing you can do is you can just call the office direct at 800-300-9300. 800-300-9300. You can remember that, and you could actually call right now from your car, and they'll give you information about an appointment if you want.
All right, just remember, don't tell my wife.
Never.
Thank you so much for your call, Juan. We appreciate it. Our number is 866.
I love the humor.
Yeah, we need humor. 866-870-5752. And let's go to Nina in Los Angeles.
Hey, Nina, Dr. Marc Darrow, how long has your heel been bothering you?
My heel, I had a surgery. That was back surgery. That's all right. I don't have a problem. And it's already well, and I had with the knees, I was to see you after about 1 year. It started to bother me. If I am walking, that's perfectly okay. When I go to sleep, and always in middle of the time of the sleep usually wakes me up. I wake up and I walk a little bit and back again. It's fine. So I don't know, is anything to be done? Bottom of my heel.
Well, the bottom of the heel has a lot of different things going on. The bone there is called the calcaneus, and the back of the calf muscle attaches to the back of your heel and goes a little bit underneath it.
But again, I don't know. I cannot describe this. I know it's the back of the heel, and it wakes me in the middle of the night. Not only when I sleep. When I go, it's fine.
I know. Nina, I actually heard you, so I'm trying to respond. So the calf muscle, every time it contracts, attaches to a place. Let me talk, please. That is on the back and the bottom of the heel. And it goes through what we call the Achilles tendon, which pulls at that spot. So that is an area that we generally can heal very quickly using platelets and or stem cells. I'd have to touch the area to find out that what I'm talking about is real. I'm just responding to what I think you're talking about. So if you want to come in the office, call 800-300-9300, and we can check out your knees and your back and all that stuff at the same time. Okay, we're going to move on to Grant.
Okay, well, actually, we're going to hold on because we have to take a quick break. You're listening to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens. Grab a pen or a pencil, write down this important information about to come your way, and we'll be right back.